Welcome everyone. Today we are going to talk about femoroacetabular impingement. In this video, we will cover what is femoroacetabular impingement and what are the types of femoroacetabular impingement. So femoroacetabular impingement is the abnormal contact of the femoral head neck junction and the acetabular ring due to any anatomic variation of the hip, which is either on the femoral head neck junction or in the acetabulum, and this abnormal contact occurs during the functional range of motion of the hip joint, and it is one of the primary causes of osteoarthritis in young patient younger than 50 years of age. Coming to the types of femoroacetabular impingement. The types of femoroacetabular impingement are cam impingement, pincer impingement, and a mixed type. So what is this cam impingement? In cam impingement, there is a bony overgrowth or prominence of the anterosuperior part of the femoral neck, leading to the contact between the femoral head neck junction and the acetabulum during functional range of motion, especially in flexion and internal rotation. The other cause is a decreased offset of the femoral neck. So if the femoral neck has a decreased offset, anterior offset, this also causes cam impingement. The second type is pincer impingement. Pincer impingement is basically a over coverage of the acetabulum. So in pincer there is a problem at the acetabulum side. So the acetabular rim has a area of over coverage of the femoral head, leading to the abnormal contact in the functional range of motion. Now this over coverage may be global, that is both anterior and posterior over coverage, as in a protrusio acetabuli, or a localized over coverage, as in a interior anterior coverage due to acetabular retroversion. So normally the acetabulum is anteverted. However, if there is a retroversion, this will lead to an anterior over coverage. The third type is a mixture of the cam and pincer impingement and is known as the mixed type. Coming to cam impingement. Cam impingement is also known as tilt type impingement or a pistol grip impingement, because in the X-ray we have a appearance of a pistol grip. So cam impingement occurs in flexion and internal rotation, because in flexion and internal rotation, this overgrowth of the anterosuperior part of the head neck junction comes in contact with the acetabular rim. Now this leads to a tear at the base of the labrum at the junction of the labrum and the articular cartilage. This injures the articular cartilage and there is a delamination or separation of articular cartilage from the underlying subchondral bone, progressing from the acetabular rim. Now in cam type impingement, the acetabular labrum is relatively spared compared to the articular cartilage, and cam impingement is seen more in young athletic males. Coming to pincer type impingement, as we saw, this is due to acetabular over coverage, which can be generalized as in a protrusio acetabuli or a localized over coverage as in retroversion. Now what happens when there is a increased coverage of the acetabulum? The femoral neck abuts against the acetabular rim and the labrum. So there is an over coverage. The femoral head will abut against this labrum, and the labrum gets pinched between the two bony surfaces, that is the femoral head and the acetabular rim, and in this type of impingement the labrum suffers more damage compared to the articular cartilage. So in cam type we saw that the articular cartilage suffered more damage. However, in pincer type the labrum suffers more damage compared to the articular cartilage. Now due to this continuous irritation, there may be reactive bone growth formation at the acetabular rim, which further worsens the pincer impingement, leading to more over coverage. Another characteristic pattern of this type of impingement is the countercoup injury. it occurs in the posterior femoral head. So when an impingement occurs anteriorly, there is a counter coup injury in the posterior part of the femoral head and the postero-inferior acetabulum. This is a classic picture in pincer impingement. And pincer impingement is more common in women, and CAM was more common in young athletic males. Coming to the clinical examination, we have test for anterior impingement, which is the flexion, adduction and internal rotation. Here the limb is flexed to 90 degree, adducted across the midline and maximally internally rotated, and this will cause a sharp pain. Also, we can look for decreased internal rotation compared to the contralateral side. For posterior impingement, we have the Faber test, which is flexion, abduction and external rotation causing pain. This is a relatively non-specific test and can be caused by many conditions like an SI joint pathology also. However, the location of the pain in this test can guide us regarding the pathology. So, friends, in this video, we discussed the definition of femoroacetabular impingement and the types of femoroacetabular impingement. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also, comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.